No, I'm really just too hit to spill.
Hey everyone, I'm Raquel Urbano from BSN2B, and for today's video, I will be showing with you how properly assess the sputum specimen collection. And without further ado, let's get started. Hello ma'am, I'm Raquel Urbano from Nueva Ecija University of Science and Technology, your student nurse. And before we start in the procedure, first may I know your name?
Then say receive.
And your birthday po.
January 16, 2009.
Okay ma'am, thank you. So, how do you like me to address you?
Dennis.
Ma'am Dennis. Okay, Ma'am Dennis. Ang gagawin po natin procedure sa inyo is sputum specimen collection. So, sputum should be cupped from deep in the chest and cupped into the plastic collection bottle to reduce the likelihood of transmission to others. And patients are encouraged to collect their sputum specimen outdoor whenever possible. So, for the assessment, first, assess the overall health of the client related to the test being conducted. Next, assess the need of the collection of the sputum. Next, assess the need for PPE or personal protective equipment. And next, for the planning, prepare all the equipment needed. First, the CHNOB bag, sterile specimen bottle, and clean gloves, mask, and goggles. Transport container, and next for the implementation, prior to performing the procedure, introduce yourself and verify the client's identity. And explain to the client what you are going to do, why it is necessary, and how he or she can participate. Next, perform a proper hand hygiene and observe appropriate infection control procedure. So, apply the proper hand hygiene. Next, if the client can perform the task without assistance after instruction, leave the container at the bedside in the instruction to call the nurse healthcare provider as soon as the specimen is produced or available. Next, check the label of the client's identification. The label should include the client's name and identification number, the time specimen was collected, route of collection, identification of the person obtaining the sample, and put on a disposable gloves and goggles. Now, indicate the name of the patient. The time and the date. Next, I will put a clean gloves. Next, place the patient in a semi-fowler position. Next, have the client clear nose and throat. Then, rinse the mouth with a water before beginning the procedure. Usually po, the specimen is collected is being done in early morning before having a breakfast. Then, so ma'am, pwede po ba kayong huminga ng malalim? Sige na po. Okay, ma'am. The cup up to 1 to tablespoon or 4 to 10 ml of sputum. So, here's the container po. I will wait po with the container. Okay, ma'am. Thank you. So, for acid pass bacillus or AFB, which also requires the following collection open for 3 consecutive days to identify the presence of tuberculosis. So, pagkayari po ng 3 araw, babalik po kayo dito para po makita ang inyong resulta kung kayo po ba ay may tuberculosis or TB. And kung the client procedures is sputum, open the lid of the container and have the client expectorate the specimen into the follow special precaution if the tuberculosis is suspected of container, obtaining the specimen. So, next, if the client procedures is sputum, open the lid of the container and have the client expectorate the specimen into the follow special precaution if the tuberculosis is suspected of container, obtaining the specimen. So, here. And next, ask the client to expectorate or cap up the sputum into the specimen container. Make sure the sputum does not contact the outside of the box. And if the outside of the container does become contaminated, wash it with a disinfectant. So, next, remove equipment and return to the client to a position of comfort. And remove goggles and gloves and perform a proper hand hygiene again. So, ma'am, pwede na po kayong bumalik sa inyong dating pwesto para po makahiga na po kayo ng maayos. So, ba? Opo. Sige po. So, place the label on a container per facility policy. Place container in a plastic, sealable, biohazard bag and or transport container. And remove PPE if used and perform hand hygiene. So, for the evaluation, reassess and evaluate the comforts of the client after the procedure. Reassess and evaluate the comfort of the client after the nursing care. Next, transport the specimen to the laboratory immediately. If immediate transport is not possible, check with laboratory personnel or policy manual whether refrigeration, documentation, the collection of sputum specimen on the client's chart. Next, include the amount, color, consistency, if thick, tenacious, watery, and presence of hemoptysis or blood in the sputum, the odor of the sputum, any measures needed to obtain the specimen, like postural drainage, and any discomfort experienced by the client. And next, record findings and nursing care is given and make an appointment either for a clinic or a home visit. And that would be all. Thank you for watching and listening. Bye!